Depression is a chronic, debilitating condition. It's common in prevalence and affects a lot of people profoundly in terms of their performance, their relationships, and their happiness. rTMS, which is repetitive transcranial magnetic stimulation, is an effective treatment that's been around for a number of years but is relatively new to the UK, and I think it's a really important treatment that's going to change a lot of people's lives. rTMS is a treatment that delivers a focal stimulus to the brain that, if it's used repetitively over time, can lead to changes in the brain, and some of those changes can be effective in treating depression. rTMS allows us to target a very focal area of the brain when treating depression, and that's the dorsolateral prefrontal cortex. And it's believed that by targeting this area, we're actually impacting on deeper areas of the brain, such as the limbic system, that are very important in the way that we regulate our emotions.
rTMS is suitable for a very broad range of people with depression. It's been approved by NICE for treating depressed people who do not respond to medication. It's also useful for patients who do not tolerate medication, and is also a safe treatment for pregnant women with depression. rTMS is often confused with ECT, but it is in fact a completely different treatment. Having rTMS does not require general anaesthetic, and rTMS does not cause memory problems. People having rTMS can return to their usual activities, including work and driving, immediately after treatment. Patients have an initial assessment with a consultant psychiatrist who specialises in TMS. The consultant will review the diagnosis and will look at the best course of treatment for the individual patient. We'll look at the practical aspects of TMS and will tailor it to the needs of the individual patient. rTMS is a flexible enough treatment, so there are several protocols which can be used depending on what is required and what actually suits the practicalities of treatment. The first treatment session will involve the consultant psychiatrist and the treating rTMS technician. The consultant psychiatrist will measure the patient's head to locate the ideal spot for TMS treatment, and will also work out the minimal effective dose of treatment that is required. Following this, the consultant psychiatrist will prescribe a number of sessions and the exact treatment protocol. Typically, patients will have 20 to 30 sessions. The patient will be evaluated every treatment session and be reviewed by the consultant psychiatrist once every 2 weeks. If necessary, the treatment can be revised to fit the needs of the individual patient. This treatment can be used alongside other treatments for depression, and would in fact encourage our patients to have talking therapies as well as having TMS. Medications can also be continued if that is necessary.
What's really important for any treatment is that a patient is able to undertake the treatment and complete the treatment. And one of the things about rTMS is it's extremely well tolerated by patients, and the completion rate is very high.